Key elements for success. So I want to kind of walk through this because every patient is unique and you need to really tailor what you're doing with them and how you're counseling them. So I'm going to pause for a second and show you what I do. So I have my blue EarWay Pro sitting here, and I also have an ear model that sits in almost all of my rooms. And one of the things that I really like is I like it because I do it, is because after I look in the patient's ear, I will tell them, yes, I see wax. No, I don't see wax. Your wax seems like, and you'll see my favorite slide in the presentation in just a few minutes. But when I pull out the earway toe and I take it out of the packaging, I will often take it and I will put it up against now I make everybody wash my hands in my office, but I will put it up against their skin and I'll show them what it feels like. It's flexible. Look, it's turning, it's soft, it's plastic, it's not a big deal. I know their hands are clean because, again, I made them wash them. So I don't feel worried about that, but I will show them what it's going to be like, just like when I use metal curettes or when I put a speculum in their ear. All my speculum are pretty cold. And so I will always warn them, this is cold. It's what it feels like. They'll be so much more comfortable when you start the procedure if you show them and tell them what's happening. So I've got my ear. This happens to be a cochlear implant ear. But the reason why I like it is because it's open. So the video that we just saw is really great because we know what we're looking at, but patients don't. And again, you may not, or those patients may not be sitting in the waiting room waiting on the loop. And so I can literally show them, right? I can turn in, I can go through, I can hit that first and second marker. And even when I hit that second marker, they see how far away it really is from their eardrum. And then I turn it again, that 360, and I pull it back out. So, I have one that just lies around. This is kind of my demo EarWay Pro that sits around. So it's one I can use to touch their hands. It's one that I can use to demonstrate. And I know I don't have to worry about infection control on this side, but that's a really great counseling tool that I find patients appreciate. And then they know what's going to happen and it's going to be a difference. Again, you're looking at the cerumen type, the ear canal shape, and the tolerance for pain. If you start turning before it even gets in the ear and the patient's kind of squeaming and moving their head away, you need to recounsel. You need to think about ways that you can actually help them understand that it's really not that difficult. This is what you're going to feel. Touch the product to their hands again, and I think with just a little bit of extra counseling, you can get over a lot of those hurdles. I also don't think it's a bad idea to have some type of serumologic in your office, whether that be an over-the-counter product that you're getting from Warner, whether that be something as simple and easy as like an oil-based system. But sometimes just that little extra bit of lubrication, if the patients aren't allergic, can make a big difference. Like everything, a little bit of practice makes permanent. So don't get frustrated if the first time it doesn't go as swimmingly as possible. But that being said, if you're going to start to implement anything new, start with kind of your normal, healthy adults that you're used to seeing and they have a good rapport with you, because that will make implementing a new thing really much easier and you'll become much more successful because they're willing to give you some of that feedback, as opposed to maybe just the new patient or the one that you've seen every single time. And when you refer them out for cerumen removal, that you get the report back about how long it took them and how terrible it was, and the patient was bleeding like crazy. So you don't want to start with your diabetic patients. You don't want to start with your patients that are on blood thinners. You want to start with your healthy adults, and you want to make sure in the senior population, which I realize many audiologists are working with, we're making sure that their cognitive function is good so that they understand what's going to happen. As I just commented on the video, I love cerumen removal. And I think taking that plug out and oftentimes showing it to people, I always ask, do you want to see it? And the majority of them say yes. And it's just an eye-opening experience. And as we all know, if it was totally occluded and then you've taken it out and now the ear's open, you've become like the king and queen of audiology, because you took them from maybe hearing loss and or pain and or otalgia and or dizziness, or whatever pain and otalgia are the same, tinnitus and dizziness, and now you've given them kind of their quote unquote normal lifestyle back, and it's very rewarding. um, I charge for everything. I'm fully unbundled. Many of you have probably heard me give those spiels besides the EarWay Pro. So this is a great revenue. And spoiler alert, I do work with Dr. Dykstra, but I can say probably half of my new patients come through a Saruman type of appointment. And that leads to other things: hearing protection, over the counter sales, hearing testing, tinnitus testing, all those other things that we have in our wheelhouse that can really help us move these patients to know what audiology does and how we can help them.